Hello, it's Dr. Patrice here to talk about why heart disease is a leading cause of premature death in Black men. Heart attacks, heart failures, arrhythmias. It seems as if more and more Black male celebrities and public figures are dying prematurely from heart disease, often in their 50s and 60s, and alarmingly, even as young as 30s and 40s. Although heart disease is a leading cause of death in the United States, Black men are disproportionately affected. According to the U.S. Centers for Disease Control and Prevention, CDC, Black men are 30% more likely to die from heart disease compared to non Hispanic white men. Whether you're a Black man within these age ranges or you have a friend or family member who is, this issue can hit close to home. June is National Men's Health Month, dedicated to spotlighting men's health issues and promoting health practices to prevent or address them. Given that heart disease disproportionately impacts the Black community, it is essential to have this conversation. Heart disease. The CDC defines heart disease as various conditions with atherosclerosis or coronary artery disease, CAD, being the most common in the US. This condition occurs when plaque builds up in the arteries that supply blood to the heart, reducing blood flow and increasing the risk of a heart attack or other cardiac events. Picture the heart's vessels as pipes that supply water to your house. Over time, these pipes can become clogged with debris, much like how plaque builds up in CAD. As the debris accumulates, it narrows the pipes, restricting the water flow. Similarly, in CAD, plaque buildup narrows the vessels, reducing blood flow to the heart. And over time, if the blockage becomes severe, it's like a fully clogged pipe, leading to a lack of water reaching the house. In the case of the heart, this decreased blood flow can result in a heart attack or cardiac arrest. In practice, I have primarily cared for Black men who were either at risk for or had a history of heart disease. Some scheduled their visits due to symptoms, while others came for their annual preventive visit or a checkup. What I have noticed is that many of our men are not aware of their risk factors or how to slow the progression of a cardiac event once diagnosed with heart disease. This observation leads us to ask, why is heart disease such a common cause of premature death in Black men? There are various reasons why heart disease is a common cause of premature death in Black men, such as disparities in healthcare provider decision making, fear of the unknown, not practicing preventive health behaviors, or not making routine checkups. However, the National Institutes of Health (NIH) states Black men are less likely to engage in preventive health behaviors and screenings, which results in delayed diagnoses and poorer health outcomes. Preventive care is key and can prevent premature death related to heart disease. In a recent discussion on the importance of preventative care with board certified family nurse practitioner and founder of Priority Mail LLC, Eric Taylor, introduced the concept routine maintenance. Taylor described it as a routine health screening for men that heightens the awareness of preventable health problems while encouraging early detection and treatment in men of all ages. This concept emphasizes the significance of regular health checkups to maintain overall well being, much like maintaining a car to ensure its longevity and performance. Think of your body like a car, Taylor explains. Just as a car requires regular maintenance to run smoothly, our bodies need routine health care to stay healthy. Regular checkups are akin to scheduled oil changes and tune ups. They help identify potential issues before they escalate into major problems. Taylor further elaborates by comparing symptoms to a car's sensor lights. The car's warning lights alert you to check the engine or other parts, indicating a need to visit the mechanic. Similarly, when our bodies show symptoms, it's a signal to see a health care provider. Ignoring these signs can lead to bigger and more expensive repairs down the road, just as neglecting health concerns can result in serious medical conditions. When to get maintenance. According to guidelines from the American Academy of Family Physicians, the U.S. Preventive Services Task Force, and the CDC, men should get health screenings between the ages of 40 and 65, spanning from the fourth to mid sixth decades of life. These screenings cover various aspects, including diabetes, high blood pressure or hypertension, high cholesterol or hyperlipidemia, prostate cancer, and colon cancer. Your primary care provider will conduct these screenings and a physical exam during your checkup to establish a baseline or health benchmark. During this visit, you will also be asked about your health history, including any past medical issues and family history of premature deaths, along with their causes. It's important to note that the age for initial screening may vary based on individual factors such as genetic predisposition or family history. Preventing heart disease involves addressing both modifiable and non modifiable factors. Modifiable factors are things you can change about yourself, such as diet, exercise, and smoking habits. Non modifiable factors include things you cannot change, such as your age, gender, and genetics. I tell my patients to focus on three no's to manage their risk factors for heart health effectively. Number one, know your history. Family history involves understanding the health conditions of your immediate relatives, including parents, grandparents, siblings, and children. This is essential for managing your health as it provides insight into your risk factors for conditions such as allergies, asthma or lung disease, cancer, congenital disorders, heart disease, high blood pressure, high cholesterol, mental illness, seizure, stroke, and type 2 diabetes. Additionally, your past health history plays a role. While these questions may seem intrusive, they help providers gather information on your risk factors and identify areas where intervention is needed. It is also important to share any childhood illnesses, such as rheumatic fever, which can cause heart valve damage, to factor in your risk. Number two, know your numbers. Once you understand your history, the next step is knowing your numbers. Monitoring key health metrics such as blood pressure, cholesterol levels, blood sugar levels if applicable, and body mass index or BMI is vital for understanding your general health. When you have one or more conditions that are linked to heart disease, we monitor the progression based on the numbers. For instance, according to the 8th Joint National Committee, JNC8, optimal blood pressure is less than 120 over 80 millimeters per mercury. If you are placed on medication to manage your blood pressure, your response to medication will be monitored. If your blood pressure tends to read high in the office, your healthcare provider may ask you to keep a log of your readings at home. Other numbers to know include your blood chemistry and various health markers. This comprehensive approach helps identify any potential risk factors that may need to be addressed through lifestyle changes or medication. Number three, know your lifestyle. Understanding your numbers helps your provider customize recommendations based on your lifestyle, which can either enhance your health or potential risk factors. However, to gain a more holistic view of your health, It's essential to consider another often overlooked aspect: your personal and social history. This includes factors such as your occupation, where and what type of work you do, relationships, both supportive and potentially stressful, financial dynamics, spirituality, seatbelt use, diet, exercise routine, smoking habits, alcohol consumption, and stress management. These elements are interconnected with your lifestyle choices and collectively influence your cardiovascular health. By comprehensively understanding and addressing these lifestyle factors, you can take steps towards improving your heart health and reducing the risk of heart disease. As the American Heart Association commemorates its 100th anniversary this year, we are reminded that heart disease does not have to be a death sentence. As Taylor simply puts it, it's easier to stay well than it is to get well. This highlights the importance of preventive healthcare visits. Regular checkups and early interventions are pivotal in safeguarding our health from the dangers of heart disease. Consider organizing a Men's Health Day for your family or summit for the community. These types of events can serve as an opportunity for men to gather, share experiences, and encourage each other to take proactive steps in managing their health. Summer, with its many gatherings and Father's Day celebrations, is a perfect time for these important conversations and health resets. By fostering a supportive environment and actively encouraging preventive health measures, our community can play a role in improving health outcomes for Black